It's a pleasure to welcome Dr. Tom Alesi. He's a director of the Vanderbilt Eskin Diabetes Clinic, and he's also Ann and Roscoe Robinson Associate Professor of Medicine. He's the editor-in-chief of Clinical Diabetes and director of the Prevention and Control Core at the Vanderbilt Diabetes Research and Training Center. So with that introduction, Dr. Tom Alesi, I would like to welcome you here tonight, and we look forward to hearing about your scenario that you've put together to demonstrate.
I was just thinking a little bit about Andy's presentation and the question that he kept coming back to, which is why Second Life? Access to quality, to cost, even to workforce issues. And while I think for those of you that have been paying attention to the dialogue that's been going on, obviously there's not going to be a silver bullet, but I do believe that this technology that we have and are trying to apply to healthcare can be a part of that solution. So for those of you that can see this slide well, what you see is just a little bit of a history of how we have struggled with diabetes over the years. The burden both to the individual and to society is substantial. Next slide, please. This slide highlights a progression over an approximately 15-year period, and I've juxtaposed two conditions really here. One in the bottom is diabetes, and you can see the states that have the highest burden of diabetes. This picture of a patient of mine, and this is a patient of someone who will soon be blind. This is a picture of a woman in her late 50s, and this is a woman who's had poor care for her diabetes. This slide I actually use for teaching our house staff and our fellows, just to let them know of the different compounds that we have available and their sites of action. Let me speak specifically about diabetes, and I apologize if this gets a little bit detailed. I'll try to keep it. I know everyone's pretty bright, but I know sometimes the detail of a specific discipline can become a little bit unnecessary, so I'm going to try to kind of catch myself. We have personnel training that are underway in much the same way that Betsy is leading the initiative to train faculty. We're also training the nurse practitioners and the clinicians more broadly who will be delivering the intervention. I feel like we have sort of a 6-step head start because we've learned a ton from our other experience with regards to telehealth, including the stratification of patients and the assessment forms, as well as the nature of the intervention, at least part of it. Thank you for your attention as someone who's gone a little bit longer than my intended time. But let me just say that I think that diabetes is a classic chronic disease, and really does present opportunities for innovation given its societal burden, but also given the opportunity to scale and to disseminate from what we learned in this condition.
Go ahead and take a few minutes to do some surveys for the event, and then we're going to start the video that we promised to show you regarding the Air Force's workout here. Are there open questions now from those that are in the audience participating with us tonight? I did get a few questions that came in from others that sent them out to us earlier, and I can ask those, but let's open it up for the audience at this point. Any questions for our visitors, our presenters this evening? Yes, there was a question asked about sharing this in the Air Force Right Stuff, and as you know, with our efforts with these global learning forums, it's all open for sharing, because that's exactly what we want to do, is distribute and disseminate some of the advantages of these immersive virtual worlds across the Air Force community. So.
Welcome to Huffman Prairie Estate, the Air Force's virtual 3D immersive learning environment. The estate is comprised of Huffman Prairie Omega, My Base Zeta, and Huffman Prairie Chi. focus of Huffman Prairie is to provide a place where educators can identify and share the promising educational technologies that enhance learning and performance. These innovations, with the use of technologies, can then be tested and scaled to determine how they can best support learning. As we walk into the administration building, you will notice that we have offices for people from different universities and government organizations. We also tell the story of Air Force history that is associated with innovation. Huffman Prairie is named after the field in Ohio, where the Wright brothers tested their innovative flying machine. It was here they worked out the various challenges to make modernization of flying very practical. In much the same way, in Huffman Prairie, we're taking those innovations that have promise and determine how best to make those innovations practical. As we come out of the administration building, we're walking across the terrazzo towards the Virtual Education Technology Support Center. The courtyard, or terrazzo, represents the terrazzo at the Air Force Academy. Throughout the Air Force regions, we have prototyped classical and future-oriented immersive learning environment designs to explore how best to use virtual worlds in support of learning, instruction, and discovery. In the classical designs, we provide visual cues of social roles for instructors and learners, auditory features, and interactive learning tools such as virtual computers, plasma screens, and books. All help to establish a sense of situated place supporting classical learning environments. In our future-oriented learning environment designs, Air Force educators explore ways to harness the benefits of immersive virtual reality that cannot be readily done or duplicated in the real world. We will highlight the designs throughout our video tour.